So today, the topic of our discussion is reproductive health. According to WHO, the reproductive health is a very important aspect for the total well-being of a person in all dimensions of the health, which involves physical, mental, behavioral, and social. Some facts and statistics regarding the reproductive health, if we consider the problems and what are the strategies which should be adopted. India was amongst the first countries in the world to initiate the program of family planning, initiated in 1951. Improved programs covering wider reproduction related areas are currently in operation, and it is under the program name of RCH, that is Reproductive and Child Health Care Program. This includes health and education to the young people and marriage and childbearing during more mature stages of life, to make them understand that these are the important attributes to the reproductive health of a society. So some measures which are taken by the government are mainly with the help of audio, visual and print media. It is generating the social awareness among the community. Even family members, close relations are also involved in the awareness program. Sex education has been introduced in schools to provide awareness among the students during their adolescence period, and actual proper information about the reproductive organs, adolescence changes, safe and hygienic sexual practices, and the outcome of the unsafe hygienic practices related to some sexually transmitted diseases, which includes AIDS also. So information are given on all of these through various government agencies with the help of non-government organizations in all spheres of the community. Now, amniocentesis, it is actually a technique which is used to find out the chromosomal abnormalities in the developing embryo by using the amniotic fluid, which surrounds the embryo in the embryo sac. Now, it is possible to know about the genetic abnormalities as well, and it is also possible to know the sex of the fetus. And in our country, in India especially, it has been misused to check the fetal sex determination based on the chromosomal pattern in the amniotic fluid surrounding the developing embryo. And if it is not desirable, then feticide was practiced. So amniocentesis technique is useful to know the abnormalities of the growing fetus, but at the same time, we must be careful about its misuse, abusive uses. Now, with the improvement in science, medicine, diagnostics, etc., the population quality of the life of people have improved. So there are increased health facilities, increased diagnostic systems, and better living conditions, which increase the total lifespan of the people. And as a result, rapid decline in the death rate, then maternal mortality rate, and also the infant mortality rate has declined a lot significantly during this period. And along with this, increase in population of reproductive age is the main reason, that is for population explosion. So although science has increased the lifespan of the people, but at the same time, we must be careful about the population explosion. And that is why it is important to control also that population explosion. So steps to overcome the population problems of the population explosion, we need to control the population. And for that, the various methods to be used are using various contraceptive methods, creating awareness among the people about demerits of large family, about the problems of the large family, increasing the marriageable age of females and males so that they attain their reproductive maturity, they are able to take the responsibility of the child, newborn baby they have, and they must be careful about their own health also. and providing incentive to parents having 2 children. So the number of children should be controlled. So these were the steps, and it has been effective for some years in our country. Now, the various contraceptive methods we need to learn about, which are used to prevent the unwanted pregnancy, are the ideal contraceptive methods should be user friendly, it should be easily available, it should be cost effective, it should have no side effects, should be easily reversible, and it should not interfere with sexual desire and sexual act. So these are the few criteria for developing the important contraceptive methods. Naturally, the contraceptive methods which are in practice, they can be divided into following categories. One is natural and traditional method. Number two is barrier method. Number three is all intrauterine devices. Number four are oral contraceptive methods. Number five includes injectable methods. Number six are the implant methods. And number seven are the surgical methods. So natural or traditional methods work on the principle of avoiding the chances of the ovum and sperm to meet in the fallopian tube. That is, it prevents the fertilization. And this depends upon the menstrual cycle. So it should be it includes periodic abstinence. The couples, they avoid coitus from day 10 to 17 of the menstrual cycle, because this is the time after ovulation where the chances of fertilization is very high, and so it is called the fertile period. And then withdrawal of the coitus interrupts also. Male partner, they withdraws their penis from vagina during just before ejaculation to avoid insemination. And third one is lactational amenorrhea, that is absence of menstruation after childbirth due to the intense milk feeding. At that time, no ovulation takes place, and so chances of fertilization is nil. But these are all chances. There may be by chance. So natural methods are not always very successful. Now we come to the artificial methods like the barrier methods, where mainly the ovum and sperms are prevented from physically meeting with the help of various barriers. That includes number one, condoms. Normally, condoms are used by male, which barrier made up of latex or rubber sheet, which covers the penis or vagina and cervix of the female, and it also prevents sexually transmitted diseases. Diaphragm, cervical cap, walls are barriers made up of rubber that is inserted into the female reproductive tract during coitus. Besides, spermicidal creams, foams, and jellies are also available, which along with these barriers to increase their contraceptive efficiency. Now, the advantages of the barrier methods are they are disposable, they can be self-inserted, they are reusable, and they prevent conception by blocking entry of the sperm through the cervix. And these barrier methods are also important, especially the condoms. They are mainly important for controlling the preventing the entry of the sperm, as well as it prevents STDs. No other methods can prevent STDs. Intrauterine devices are those devices which are to be inserted by doctors or trained nurse through into the female uterus through vagina. There are various types of intrauterine devices. One is like T type, that is called copper T, and then maybe hormonal intrauterine devices, which releases certain hormones like progesterone, etc. Now, these IUCDs actually increase the phagocytosis of the sperm in uterus, and copper reduce the motility and fertility capacity of the sperms. The hormone releasing IUDs make the uterus unsuitable for implantation, and so the cervix will not allow the sperms to travel functionally. So it is ideal for female who wants to delay pregnancy and also wants space between two children, successive children. Oral contraceptive methods includes oral pills, which are mainly progesterone or progesterone-estrogen combination-based pills, which are used by the females in forms of tablets. Basically, they change the hormonal level in the female, so they inhibit ovulation and implantation, as well as they change the quality of the cervical mucus to prevent or they retard the entry of the sperms. Administration of progesterone or such combination, progesterone estrogen combination, is effective if it is taken within 72 hours of coitus as emergency contraceptive also. But we must be careful about remembering that such methods are not preventing the STDs. Hormonal injections are available which are convenient and highly effective, and they do not have any serious side effects. Similarly, there are some subcutaneous implants which are effective, convenient, long-lasting and safer methods. There are some capsule kind of things which are implanted in the body containing the steroids, and they are inserted under the skin of the inner arm above the elbow, and the capsule slowly release the synthetic progesterone for successive years, for about 5 years. Lastly, we come to the surgical methods. Surgical methods involve it is used actually as the terminal method of contraception. We call it more or less permanent in both male and female to prevent any more pregnancy. So in case of males, when the surgical method is vasectomy, it is the method in which a small part of the vas deferens is removed and tied up through a small incision on the scrotum. This is the vas deferens. It is tied up through a small incision, and this will prevent the release of the sperms from the testes. Similarly, in case of females, it is called tubectomy. It is the portion of the fallopian tube where a small part of the fallopian tube is removed surgically. These techniques are highly effective, but the reversibility is not possible. Mostly, it is very poor rather. So we can call it more or less it is a permanent method of contraception. Now, side effects of contraceptive methods, some side effects are there. It includes headaches, mood swing, tiredness, diarrhea, vomiting, abdominal pain maybe, and also breast tenderness. Mostly this, one most important aspect which we must know is about medical termination of pregnancy, that is MTP. It is called induced abortion, and it plays an important role in decreasing the population by aborting unwanted pregnancy. MTP has been legalized in India in 1971 with some restriction to prevent its misuse. That means indiscriminate and illegal female feticides should not be performed through MTP. When pregnancy continues, continuation could be harmful for the mother or even for the fetus. When it is found that there may be some congenital problems, then MTP can be executed. MTPs are considered to be safe during first trimester, that is up to 12 weeks of the pregnancy. Then onwards, MTPs are much more riskier, and it should be carried out by expert doctor and trained staffs. Now we come to discuss about the STDs, that is sexually transmitted disease. These diseases are mainly transmitted through the reproductive tract. So some of the common STDs are gonorrhea, syphilis, genital herpes, genital warts, hepatitis B, and AIDS. Hepatitis B and HIV, hepatitis B virus and HIV, they are transmitted by sharing the injection needles, surgical instruments with infected person, transfusion of blood, or from infected mother to fetus also. Except for the genital herpes, HIV and hepatitis B are completely curable if detected earlier and treated properly. It can be controlled. And timely detection and proper treatment of STDs are very important. Otherwise, it leads to complications which include various other internal problems of the internal organs, that is pelvic inflammatory diseases, unwanted abortions, stillbirths, ectopic pregnancies, infertility, and even cancer of the reproductive tract. So, how to prevent STDs? Number one, avoiding sex with unknown partners or multiple partners. always by using condoms during coitus, because it is the only barrier which can prevent STDs. No other methods are responsible for that. And if there is any doubt about the having STDs, then a person should go to the qualified doctor for early detection and get complete treatment if diagnosed. Now, regarding infertility, it is a health problem when the couples are unable to reproduce children in spite of unprotected sexual act. And the reason may be various. It may be physical, congenital, or due to some drugs, immunological, or even psychological. These infertile couples can be assisted to have children through some special techniques which are commonly called together assisted reproductive technologies, or ART. This includes IVF, that is in vitro fertilization. In vitro fertilization is the process of fusion of ovum and sperm outside the body of the female, followed by the embryo transfer, which is commonly called test tube baby program. The ovum from the donor female partner and sperms from the male partner are collected and then induced to fertilize in laboratory condition outside the body, just like in a test tube. And that results in the zygote, and then zygote develops into an early embryo with 8 blastomeres. And at this stage, the blastomeres can be transferred into the fallopian tube of the mother by a technique called ZIFT, zygote infrafallopian transfer. And the embryo with more than 8 blastomeres, they are transferred into the uterus through intrauterine transfer, so that they can complete the further development. And there is another method which is called GIFT, gamete intrafallopian transfer. It is the transfer of gametes collected from a donor into fallopian tube of another female who do not produce ovum. Now for the exam purpose, it is important to know all the full forms of the following and the difference between ZIFT, GIFT. These are very commonly asked during the exams. Besides, there is one is called intracytoplasmic sperm injection, which is a specialized procedure to form an embryo in laboratory in which sperm is directly injected into the ovum. And the last technique we can discuss is about artificial insemination. Infertility, when it is caused in which the male partner is unable to produce healthy sperms, then they are treated by this technique in which semen is collected from donor and that is artificially introduced into vagina or into the uterus of the female, and this is called artificial insemination. So all these techniques require extremely high expertise, handling by specialized professional and expensive instruments. So the benefits are there, but benefits are limited to certain category of people maybe. And since these are all artificial methods, there are various other factors which include like emotional, religious, and social factors, which also prevent the ready adoption of these methods by the common people. So anyway, to summarize, it is important that the reproductive health is important, number one, for control of population, and secondly, to control or to stop the sexually transmitted diseases. And that is extremely important for the society, because the parents' health will obviously determine the quality of the life of the children. So as a responsible citizens, we must be very careful about maintaining the reproductive health of the population.